Well, hello and welcome, everybody. It's Dr. David Hargroder with the Mini-Gastric Bypass, and I'm here today with a very special guest, Miss Samantha. You want to tell the audience a little bit about yourself?
Hello, I'm Samantha. I had surgery in December of 2021. Um, when Dr. H and I discussed the surgery, I told him that I was going to be happy if I lost 100 pounds, and I've lost 130 pounds.
Awesome.
So, yeah, I've been able to keep that off. I have a much more active life now. I bike with my husband. He bikes about 11,000 miles, and since I work all the time, I'm pretty lucky to get 1,000 miles in a year. But yeah, I did my first 100 miler about a year after having surgery, so life is great.
That's amazing. Now, how long had you sort of contemplated or thought about uh, weight loss surgery? Like, did you do like most everyone, go through all the different weight loss exercises and Weight Watchers and this one and that one and all of these other? Did you go through all of that before coming to the decision for surgery? And how did that decision for surgery come about?
Well, actually, my father was an overweight gentleman, and in 2020 he got very sick and was diagnosed with kidney disease. And in 2021, he passed away. And obesity had a lot to do with that. And at the time, my life was going through quite a bit of changes. I had filed for a divorce. I had lost my dad. And my doctor informed me that if I didn't lower my blood pressure, that I would have a stroke at 34. And so we started talking about options, and I had contemplated with my father a few years before that about weight loss surgery. Had He and I had had a conversation about it. And so that was brought back to the table. And then I started visiting with others who had had the weight loss surgery, and they had had different versions of it. And I found Dr. H and liked the results of his patients. And so that's the route that I took.
Good. Yeah, I like it when people really do their research and look at the different options, right? They've got the
Mhm.
sleeve, or you got the Roux-en-Y. Now you have the Sadie and the duodenal switch and all these different operations out there. So it can be a little bit challenging. Was there any particular bit of information that you got from our team or from what you researched with the mini gastric bypass that led you to this particular operation over any of the others, or was it something different?
Well, like I said, I talked with others who had the sleeve specifically. The majority of them had had the sleeve, and
Yeah,
their success rate was very low. They lost quite a bit of weight in the beginning, but then they just started eating like normal again. And I knew that that's not what I wanted. Again, if I was going to come off of high blood pressure medicine, keep my blood pressure down, come off of the weight, the weight comes off, and the water pills. I was on all of that before. And I knew that whatever I did would have to be permanent. And
right.
that was one of the things that I liked the most about the mini gastric bypass surgery was the fact that the results, as long as you stick to the plan, the results last.
Right. Yep. And we encourage, long-term follow-up, and we offer free follow-up for our patients for life, as far as getting in touch with our office, touching base with me, that sort of thing, even coming in for an office visit if you need it. We try to make ourselves as accessible as we can because
Mhm.
that is the best way to have good long-term results, is to be staying in touch with us. Uh, do you remember like this? I know it's been a few years, but do you remember the experience? How was that immediate the day of surgery, the few days after surgery, was it what you expected, better or worse, or how would you describe those days if you recall, if you remember them?
Hmm. Well, I remember all the paperwork. I remember I remember calling Sherry and being like, I don't know what I'm doing. And she's like, just listen to me. I was like, okay, I will listen.
Yeah,
Your office,
Sherry will walk you through the process pretty well. So
she does. And she's amazing at, you're right. She is amazing at what she does. That woman is just awesome. I have to say that was one of my favorite phone calls. And I came away saying, okay, I can do this. Um, But the day of surgery, it was nerve-wracking a little bit. You know, it's a huge life commitment, but it's for the best. And so I was nervous but excited for a good future. I knew that it was going to do what I wanted it to do. Um, and the week following, I remember going to your office and my blood pressure was still a little high. And I was like, oh no, it's not coming off. It's not going to work. You know, I went through all of that emotions. And then
right,
in about 2 weeks after that, I was completely off of everything. I
good,
was off
good.
of the blood pressure medicine, everything. Um, you know, it was a little tough trying to, drink as much water as you're supposed to. That and Gatorade. Oh my goodness, I hate Gatorade. I hate Gatorade, but there are
We
some
do
days
push
that,
Gatorade pretty much in those first few weeks, don't we?
oh my gosh, you do. Well, and it's good, because that's what your body needs. And there's some days when the weather is the triple digits with all of the humidity, and
Sure.
I have to drink Gatorade
Right.
just to keep my levels and my electrolytes up and everything, stay hydrated. Um, but looking back, I all I have is joy that I did it.
Hmm.
Because it is a whole different life that I'm blessed with. So,
Yeah. How would you say, like, how would you say that the surgeries changed your just your daily routine?
hmm.
Is that too broad of a question?
Well, I can tell you a few things. Like I said, I biked my first 100 miler about a year after having surgery. I could have never ever done that weighing almost 300 pounds. Could
Sure.
never have done that.
Yeah.
Um, I can confidently wear a bikini, which I
Uh-huh.
have never done in my life until after losing the weight. I can hike, I can run, I have as much energy as when I don't know, even before the weight as an adolescent.
Right.
I can keep up with my friends who are are active. Um, and so I don't remember what the question was now, but
No,
I
you're
have
you're you're answering it. How does your
okay.
day-to-day activities, how have they changed since surgery? And it's
Yeah.
your daily routines. It sounds like you've just got quite an active life. I always feel very like a proud parent, when my patients look like they're doing better than I am. It's like I don't think I could go out and ride 1,000 miles on a bike. So the fact that you're doing it's just awesome. So
Yeah.
all right. How about your relationship with food? How has that changed before
Hmm.
surgery and now?
I look at food differently, um, because of how much protein we have to have in our daily life. Um, if I know we're going to go someplace and there's going to be a cake, like a wedding or an anniversary party, like we just had a couple weeks ago, um, I know to load up on all my protein, and then I can
Right.
have a small little piece.
There you go.
Um, yeah. Or if there's fruit, then I'll go have the fruit instead of a small piece of cake or just one bite. I do look at food differently. My grocery list looks different. My cooking style is different. It's mostly protein with your fruits and your vegetables. Um,
Is there a
even my
is there a
family has
sense
noticed.
is there a sense of being deprived, or are you satisfied?
Oh, no deprived, not at all. I mean, granted, in the first couple of weeks when all you're doing is the liquid, yeah,
Yeah,
you're a
Gatorade
little
Rock.
deprived. But other than that, no, I don't ever feel like I'm missing out on anything.
Yeah,
Um, because I know what some of that leads to. If I want a small piece of candy, I'll have a small piece of candy. If if
absolutely.
I if I want croutons on my salad, I'll eat a couple croutons on my salad. I never feel like I'm being deprived or missing out on something. Now, granted, when there is a large steak on somebody's plate, and I
Yeah.
think, ooh, I used to finish that kind of steak, but I can still eat steak. I can have a few pieces and I'm full. So,
Yeah. Um, any funny stories along your journey that you want to share? Anything you can recall
mm,
that
any funny
anybody not
stories?
recognize you or
Oh
anything like?
Lord. Yeah, lots. Oh my goodness. I have been friends, when I had the surgery, it was still kind of COVID. And
Right.
so, right, so we really hadn't seen a lot of people face to face. Um, and I walked up to one of my friends who has known me since I was very little, and we kind of drifted apart during that COVID time. Again, it was really bad for me. And I walked up to her and said hi, and she goes hi, and then she goes, "Wait a second, I know you." And I was like, "Yeah, you know me about 100 pounds heavier." And then it clicked who I was. So yeah, that's always kind of fun to, I could walk around Walmart as, the weight was coming off, and most of the people wouldn't recognize me, and that was okay. But yeah,
Now,
there's been a few family and a few like relatives who I haven't seen in a long time. We were sitting right next to each other and I knew them, but they didn't know me until I leaned over and said something that would resonate as a family that only family would know it. So yeah, I've had a few of those moments. Those are fun.
that's pretty cool. What about any thoughts or words of advice for anybody that is going through struggling with their weight and contemplating, weight loss surgery?
Oh, yeah, I have people ask me that all the time, actually. As especially in the first about 2 years of surgery, as I was sharing milestones for myself, like I'm down 100 pounds. This is my anniversary of when I had surgery, things like that. And then they send me messages and want to know how I did it, what are the pros and the cons. And truthfully, the pros outweigh the cons. If you're thinking about doing it, do it. It's a lifetime commitment. It is a new way of living, but it is a good way of living. You'll have so much energy, be able to do things that you didn't think you could do. Like we're going canoeing, and I've never canoed. I know you can do that at any weight, but I think it's amazing to be able to do new things and feel like I have the energy to do them.
Right, definitely.
And that's really it.
Is there anything you wish you had known then that you kind of know now after the fact about the whole process and advice that someone would have given you before, or do you feel like you were pretty well prepared?
I think I was pretty well prepared. Um, the hair loss was a big issue for me. I
Right.
lost a lot of hair, and for a little over a year, I was losing hair until somebody told me about this amazing shampoo that's a biotin shampoo. And so I've actually have friends who they haven't had the surgery, but they're losing hair, and so I've passed that information on
Yeah.
um, to use the biotin shampoo if you're losing hair, because
I'll be the
after about a month, it stops.
Yeah. Okay.
Yeah,
Very good. Uh, that's great advice. I know we offer a biotin supplement, so I didn't know they made a biotin shampoo. So
they do.
I've learned something today. I'll be able to pass that on to my patients.
There you
All
go.
right. Well, listen, I really do appreciate the time you've spent with me, sharing your experience. It sounds like it's been really quite the life changer for you in terms of activity and everything, relationship wise, family wise, energy wise, health wise, off your blood pressure medicine. So that's pretty awesome. Uh, I think that's really all. I usually kind of one of my last questions, but I've already asked it. What advice do you have? And you gave a great answer. So I just tell you, congratulations, and on this upcoming year, maybe shoot for 2,000 miles instead of 1,000.
My husband would love that.
All right, Samantha. Well, again, thank you so much for taking time, and keep your follow-up appointments. We're here for
Yes,
you.
sir. Thank you so much.
All right. Take care.
Bye.
Bye bye.